Hello, everyone. Rachel here. I'm just waiting for a few more people to come on, but it is so nice to meet everybody and see you all. So this is my childbirth masterclass where we go over prenatal care, some childbirth information. We can go over postpartum care, newborn care. This is actually part 2. You can see part 1 if you missed it. It was last week, but you can see it actually on the uploads. You'll be able to see the last one as well. I'm still going to give everybody another minute. So I just wanted to start off by saying hi. My name is Rachel. I am a postpartum nurse. I work in the hospital, and I also do actually live visits as well. So I help moms and their babies get ready for delivery. I help them once they take their baby home to kind of prepare, learn how to breastfeed, learn how to take care of their baby. So lots of great stuff. So like I mentioned, my name is Rachel. I have 2 kids. So we have a few people on. Maybe you can just say your name and where you're from, maybe how many weeks you are. That can also kind of help to gauge what we can talk about for today's session. So my name is Rachel. I'm from Florida. I have 2 kids. I'm not exactly pregnant right now. I have a 5-year-old and I also have a 2, almost 3-year-old, but it is a pleasure to be able to work with all of you. So like I mentioned before, this is part 2 of our childbirth masterclass. Part 1 was about pregnancy, of some childbirth, and part 2 is about postpartum care and newborn care. That's pretty much how to take care of yourself and your baby after delivery. So we have Samantha from Pennsylvania, 32 weeks tomorrow with her first baby. Congratulations, Samantha. I'm so excited to have you today in our class, and I hope that you learn all that you really need to know, and I hope that you're able to answer all of your questions. So to start off on postpartum care, so we did talk about in the last class that you can kind of, catch up if you needed to, childbirth. Now this is what happens after the baby is born. So what to expect after delivery, you might have some shaking, which is normal, especially after you lose all of your fluid in childbirth. Sometimes some shaking does occur. So warm blankets really helps. Hydration helps. You might even have some IV fluids after you deliver. But if you're feeling up to it, you're not too nauseous, you can also have some water, kind of stay hydrated that way. Skin to skin also helps, just kind of calm you down, calms the baby down. So that really helps with the shaking. It shouldn't really last too long. What you'll notice is maybe you'll be shaking more after a C-section than you do with a vaginal delivery. In addition to all of the hormones that you're losing in delivery, there's also a lot of kind of fluid changes. So as those fluid changes happen, sometimes you might have those shaking, but warm blankets, hydration, skin to skin really helps with that. Postpartum contractions also happen after you deliver. So many people think that after they have the baby that's it, the contractions are done, but there's actually kind of contractions before you have your baby, and there's also contractions after you have your baby. What you'll also notice is that contractions are also a little bit stronger with every baby that you have. So let's say it might be your first baby, your contractions maybe are not that so strong. I know with my contractions weren't that bad. I think I needed Motrin maybe like once or twice after I had my first baby. But then with my second, oh man, every time my baby went to the breast, because contractions get a little worse as you're breastfeeding. It was a lot stronger. I actually had to have Motrin maybe like two or 3 days after I had the baby, just because your uterus is getting back to its original position. And as that happens, of course, you're going to have some contractions as your uterus is getting back to that original position. And then with every baby that you have, of course, you're going to have to work a little bit harder to get onto that. So I see we have a few new people. So if you just came in, you can say your name, maybe where you're from, how many weeks you are. I know we have Samantha from Pennsylvania, but I see we have a few other people too. Most people, when they take their class, they're in their either second or third trimester, I noticed, but it's also very good because it's a good reminder. This class, by the way, the PowerPoint, although you won't be able to download it straight from YouTube, if you actually sign up for the next childbirth masterclass, which if you see, there's a link in the description that says like you can sign up for free classes and things like that. On that link, there's also a link to sign up for the next childbirth masterclass. And there's also a link to sign up for my free online self-paced class. So with those classes, you'll be able to download the PowerPoint and eBooks and a whole bunch of great resources for you guys. So we have shaking as the baby is born. You know, of course, you lose that amniotic fluid. You might have some postpartum contractions, especially as your uterus is getting back to its original position. And then mood swings. Mood swings can happen after you have a baby. Just call your doctor if you think you might have postpartum depression. Now, postpartum depression differs from baby blues a little bit because, for one, baby blues is very circumstantial. It usually is very short-lived. It doesn't really get in the way of day-to-day life as much as postpartum depression. Postpartum depression is usually a lot stronger. It lasts longer. It can even last years. And that does get in the way of daily life sometimes, especially if you start finding yourself thinking bad thoughts about you or your baby. So if you feel like your baby blues might be heading towards postpartum depression, you'll definitely want to talk to your doctor, see about maybe getting a referral to see somebody, talk about some things, talk about whatever situation that you might have. And then, of course, I mean, postpartum depression especially has been increasing lately. I think maybe also because more people are home. What you'll find is that a lot of people that used to have support from their family and their grandparents, you know, and all these other people, now they're kind of secluded in their house. And then, as you know, a support system really plays a big role in your family. So then as your support system kind of is not really available as much, I think that might be one reason why postpartum depression rates have been increasing. And then another thing that you'll notice is period-like bleeding. So it lasts from a few days for, you know, even to a few weeks. Everybody's different, but just definitely call your doctor if you're getting big blood clots like the size of my fist or greater. If you're filling up a pad in an hour, especially, or if you have any other concerns about your bleeding. So like, let's say you're looking at your lochia because you're going to have some bleeding after you deliver, but it definitely should not be heavy bleeding. It's more like your period starts out kind of bright red, then it gets darker and darker, kind of brownish, and then finally you stop. If all of a sudden you're getting bright red again, you're getting blood clots, or it's coming out very, very heavy, you'll definitely want to talk to your doctor about that and see what they might be able to do for you. Then after you have a baby, it's very important to have good postpartum hygiene. So after you have a baby, in addition to taking care of the baby, you also have to take care of yourself. So we have vaginal care, try to change your pads every few hours, keep yourself clean because you don't want to get yeast infections, you don't want to get UTIs, anything like that. So my rule of thumb is try to go pee every 2 to 3 hours, and you can kind of make that your routine also. So let's say you're feeding your baby every 2 to 3 hours, you can go pee, you can feed your baby, but definitely try to pee first. Then you can try to feed your baby, drink a glass of water. And if you make that your routine, it'll definitely kind of help you to remember like, okay, it is time. And then when you pee, what also helps is, because I know that sometimes people get a lot of pain in that vaginal and perineal area. So when you pee, if you actually use that peri bottle, that clear plastic bottle, and you use it at the same time that you pee, it'll actually neutralize the acidity of the urine and will actually help for your pain down there. So that actually helps a lot. So we have vaginal care, change your pads every few hours, try to pee every 2 to 3 hours. Use that clear plastic peri bottle until you stop bleeding also, just because the longer that blood stays there, the more chance of yeast infections and UTIs that you have. And then you can use perimeds such as Dermaplast and Tux pads. Dermaplast is the spray that really, really helps to kind of heal the area, kind of prevents that pain. Also, Tux are for hemorrhoids, but you can use it in the front as well. So they work really, really good. And then nothing in the vaginal area for 6 weeks. That includes tampons, that includes douching, that includes, any sexual intercourse, anything like that. Nothing in the vaginal area for 6 weeks that will prevent any complications. And then call your physician if you have any heavy bleeding, like we mentioned before, if you fill a pad in 1 hour, if you find yourself getting big blood clots, anything like that. So it's very important. I know that sometimes you're taking care of your baby and all the focus is on the baby, but you have to be able to take care of yourself too, because it'll be very difficult for you to be able to take care of your baby if you're not taking care of yourself. So for me, as I mostly work postpartum, so this is my this is kind of my specialty right over here. But I notice all the time that a lot of my patients, they're so focused on their baby that when it's time to focus on themselves, they don't really think about it. I know it's kind of a mom thing, but you definitely want to be able to take care of yourself as well. So our next section is, I know that you all probably want to have vaginal deliveries, but just in case, I think it's important to know what to do in case of a cesarean birth. Of course, they do happen. Sometimes you even had one in the past and you're going to go in for a repeat, something like that. And it's very important to know how to take care of the incision site. I know that most people, they're always focused on how to take care of the baby or how to take care of the perineal area, but very rarely do you actually look into how to take care of the incision site. So number one is you can still take a shower with a C-section. So even though you had a C-section, you still want to be able to take a shower. You still want to keep that site clean and dry. And then when you're done taking a shower, you could just pat it dry. And sometimes even people like the same peri pads that you use down there, you can actually put on the incision site. And sometimes that kind of helps if you have a little bit of that overlap, like some people do. If you have one of those peri pads and you put that there, sometimes that will actually even kind of help to catch any excess sweat or drainage or anything like that. But call your doctor if there's any excess drainage, if there's any foul odor, swelling, all of those can be signs of infection. So you can still take a shower with a C-section. Just when you take a shower, try not to use any of those scented, I know sometimes they have those like scented scrubby soaps and things like that. Try not to use those if you have a C-section, just because you want to have at least chance of infection as possible. So as you have anything in your incision site, of course, that increases your chance of infection. So what you can do is try to have just a very cleansing soap, nothing that really has any of those scrubbies or anything like that. Keep your incision site clean and dry after. You can pat it dry, and then you can also use an abdominal binder for support as you need. And then, of course, you might have staples, glue, stitches, steri strips. That's one good thing that you can talk to your doctor about, is what do they use to close the incision site. Some people use staples, some people use glue, some people have stitches. I like steri strips. Those are kind of these surgical tape, if you think about it, that kind of just goes over the incision. Some people might have staples for a little bit, and then they might take the staples off and change them to the steri strip. So it all depends on the doctor too. And then you can always request certain things as well. And then just so you know, this is just a little part of my class, but I do have an online class, which is amazing. And then we have a few people on now, but in the end of my class, so for those of you who are active in this class, we will be having a quiz in the end. And then whoever's active in that quiz will actually be able to have my giveaway. So I have a giveaway in the end of the class that's going to be for my full 26-day childbirth masterclass. That is a wonderful class. It goes over pregnancy, childbirth, newborn care, breastfeeding, a little bit of everything. So we'll be giving away one of those in the end of the class. So it's very exciting. And then these are just some keys to recovery. So a lot of people are wondering, how do you recover quicker? So of course, it might take some time. You know, all of this pregnancy developed for quite some time. So you don't want to overexert yourself right off the bat. And it could take anywhere from a few days to a few weeks really to start feeling better. If you had a vaginal delivery, it's normally a few weeks for you to feel better. If you had a C-section, of course, it's a surgical incision and it's an abdominal surgery as well. So as you have abdominal surgeries, it's going to be a little bit more for the recovery process. So number one, key to recovery is try to drink a lot of water. So a lot of people, they kind of forget about the water drinking part, but you want to try to drink at least a glass of water every time you feed the baby. So if the baby's eating 6 to 8 times a day, you would want to try to drink about 6 to 8 glasses of water a day as well. Sometimes even more if you can. I'm not much of a water drinker. I kind of like, I like the coconut water and all those things, but sometimes I have to force myself to drink the water. But you want to try to drink water at least every time you feed the baby. You can have a little cup of water by your side, and that can help you to remember to drink. Number 2 is walk as early and as often as possible. So you don't want to stay in the bed all day. I know sometimes after you have a baby, you're just like, oh, I'm so tired. I just want to lay here. But what you can do is try to walk, every 2 to 3 hours, at least go to the bathroom, freshen up, drink a glass of water, especially if you had a C-section. Because if you have a C-section, any surgery that you have puts you at an increased risk of blood clots and UTIs and things like that. So if you're walking, what happens is at least it is moving your blood, moving your circulation. It's good for the circulation and will help you recover. So my keys to recovery, number 1 is to drink a lot of water. Number 2 is try to walk as early and often as possible, at least during the day. If you're at night, it's okay, but at least during the day, try to drink water, try to walk. And then number 3 is urinate. Try to keep that bladder empty. It helps to reduce the risk of postpartum hemorrhage. It decreases pain also. A lot of people don't realize that if your tummy is too full, it presses against the uterus, causes it to start contracting and quivering and becomes really uncomfortable. So at least if you're peeing often, let's say every 2 to 3 hours or so, it really helps to reduce that pain that you have. And also sometimes it helps just to get out of the bed, because there's something about just being in the bed that gives you that old man mentality. I don't know what it is, but just when you're laying in bed, you feel like a sick person. Studies show that actually the people that get up more, they don't have as much pain, their circulation is better, they have less complications. So at least by your getting up, you're walking, change your clothes, you start to feel more like you're at home, and it'll make you feel so much better, help you recover so much better. And if for all those people that's just coming in, you can mention your name, where you're from, how many weeks you are. Also, we can kind of get to know each other. One great part about this class is that I do like for it to be interactive as well. You can ask questions anytime. I do like to teach. I know in the beginning of the class, everybody's kind of like, oh, what do I do? How does this work? But of course, you can ask me any questions if we're going over a slide and you want to know more, like how often should I be peeing? How, anything like that. You can always let me know. I'll be more than happy to answer your questions. Also, because everyone's different. I have yet to see a baby that follows the manual exactly as the manual is. So of course, everybody has different questions, everybody has different walks of life. And that is why it is great to be able to see somebody face to face. So at least take advantage of the fact that I am here with you, that you can ask me questions. Take advantage of the fact that you have a nurse here at your disposal. So this is the time to ask questions. This is the time to be prepared. The knowledge is power. Honestly, it comes to that. The more knowledge you have, the more preparation you get, and the better you'll feel as you get closer to delivery. So we have Kim and Kia's world, Kimberly from Brooklyn, New York. She will be 27 weeks on Friday. Congratulations. That is so exciting. At least 27 weeks is also pretty good. I noticed too, in the second trimester and kind of the beginning of the third, you start to get a kind of a second wind where your energy is at an okay phase. So like 27 weeks is all right. Once you start hitting like that 30 weeks, at least for me, I started always focusing on, okay, the baby's going to be coming soon. And then as the baby gets bigger, of course, I think what happens is as the baby gets closer to delivery, you're always thinking about the baby. And you're always like, yes, the baby's finally coming. So you're heading on up there. So here's some nursing secrets. So we mentioned peeing, we mentioned drinking lots of water, we mentioned trying to walk as early and often as possible. Now here's some other nursing secrets that I've kind of learned just from being a nurse. I've been a nurse for 8 years, so at least I have some time that I've been spent, in practice. And now at least I also have my private practice now. So if you have any questions. So Anna from Atlanta, 5 weeks. This is your first pregnancy. And Anna, I think you've taken a class or something because your name sounds familiar. Unless there could be other Anna Fernandez. I'm not sure, but your name sounds familiar either way. But so this is a great way that we can at least prepare before we have our babies. So change your clothes ASAP, get out of that gown. You're a strong woman, you just had a baby. You don't want to be laying in the bed the whole time. You want to be able to change your clothes, wash your face, clean up your hoo-ha down there. You want to be able to have good vaginal hygiene. Just by changing your clothes, it completely changes your perspective. I've noticed even sometimes it even prevents opioids. So like, let's say after you have a C-section, you're in a lot of pain. Sometimes they have to have narcotics or other strong medications. What I've found is actually changing the clothes, washing the face, kind of freshening up a little bit, actually helps with the pain, that they have even less narcotics given, less stronger pain medications given. At least for me, I react horrible with pain medicine. I'm the type of person that I'll have one Percocet and I will be sick for 2 to 3 days. So at least this is one way that you can kind of avoid that, is change your clothes, freshen up. Number 2, this kind of depends on the person, but ask when your IV can be removed. I try to take out my patients' IVs when I can, as soon as possible. But of course, if you have high blood pressure, if you've had a hemorrhage, if you have any infection, any issues like that, sometimes you might have to have it stay in longer until you're actually discharged and going home. But if I have a patient that is doing fine, she's, vitals are fine, she's not hemorrhaging, she's bleeding fine, she has no sign of infection, and her iron levels are great, I will try to take out her IV for a few reasons. One is that the more lines that you have, the sicker you feel and the less you do. I want my patients to be independent. I want them to be able to walk. I want them to be able to recover better. I want them to be able to take care of their baby. Now, the more lines that you have, if you're hooked up to IVs, you're hooked up to SCDs, you're hooked up to vital sign machines, you're hooked up to all these different things, and you just feel like a machine over here, it's going to be very hard for you to be able to take care of your baby like you want to and be able to take care of yourself as you want to. So what I do is I try to take off the lines when I don't need them. So even vital sign machines, I know a lot of nurses, they'll leave the cuff on in between vital signs. And sometimes, like, that's one of my nursing pet peeves too, is like, if I have a patient that we only need a vital sign every hour, but we're leaving the blood pressure cuff on, and keeping her strapped onto the machine in between that whole hour, I'm like, why don't we just take her off the blood pressure cuff and then just come back in that hour instead of having her stuck there with all of these lines this whole time? So you, as a patient, you have the right to say, hey, how often am I getting my vital signs done? If it's every 15 minutes, okay, all right, it's every 15 minutes, I understand. But if, oh yeah, it's every hour, it's every 4 hours, you can say, hey, is it all right if I take the cuff off until my next blood pressure time, or something like that? Me as a nurse, I will be completely okay with that, because I want my patients to be advocates for themselves. I want to be an advocate for you, but in the end, you are the one that really has the say in everything. You are the one that has the say in pretty much your whole plan of care. So it's good for you to be involved, to ask questions, and not feel bad if you have certain preferences for things. That is completely fine. For the SCDs, SCDs are the compression stockings. Now, that's one line also I try to get off if my patients are walking. I actually try to get my patients up between 8 to 12 hours after they had a C-section, and then about 2 hours, 1 to 2 hours after they had a vaginal delivery. That kind of just helps to keep the circulation flowing. Now, SCDs are for bed rest patients. So if you are on bed rest, let's say you have an epidural and you can't get up, or you have a C-section and you just had your spinal and can't get up yet, you'll be having these compression stockings, which helps with the circulation because you're not walking, obviously, because blood clots are common after you have a baby. The risk of blood clots increases after you have a baby. So what that does, if you have a blood clot in your leg, it can dislodge in the leg and then it can actually travel to the lungs. And then that's how you can have something called a pulmonary embolism, which is fatal. So that's why they do want the compression stockings if you are not walking. However, to prevent blood clots, walking is the best thing that you can do. And then if you're walking, you obviously don't need the SCDs, you don't need all those extra lines. And then the less lines that you have, the better you feel, the more independent you are, and just overall better hospital stay that you'll have. So it's really great to try to get these, just feel like you're at home more than anything. Number 3 is try to shower. I don't know why sometimes I have to kind of push my patients to shower a little bit after having a baby. Like for me, it was one of the first things I wanted to do. I'm like, yes, I had my babies. Let's go. It's time to take a shower yet. So you want to try to shower. It really is a magical thing. It makes you feel like a completely new person. And then when to call the doctor for postpartum emergencies. Number 1 is if you have any fever, 100.4 or above. Even just a little tidbit too, we'll go over baby stuff and lactation also in a second, but engorgement can cause a mild grade fever as well. So if you are having a fever from engorgement or even dehydration, sometimes what you'll notice with dehydration, your heart rate will go up. And sometimes you might even have a little headache. You might even have some fever, especially if you're breastfeeding. Do I have anybody that's planning on breastfeeding? Or you can even say, how about this, everyone, before we go into the newborn part, you can just tell me what your feeding choices are. Are you planning on breast and bottle? Are you planning on breastfeeding? Are you planning on pumping? Exclusively pumping is a thing, so I can focus on each one of those and hopefully be able to give each one of you guys some tips, depending on whatever your plans are. So I know you have some people for whatever your choice might be. I just want to support you on that. So we have like Samantha's breastfeeding and pumping, which is great. I breastfed and pumped with both of my kids, especially because with both of my kids, they all had jaundice. So at least with that, I had to give a little bit of supplementation. And then the best supplement over formula, if you want to do formula, you can do that. But the best supplementation is your own milk. So what I did, both of my kids, they had phototherapy. Both of my kids, their bilirubins were high. So I was able to supplement with my own milk. So I ended up breastfeeding and pumping. And with my second baby, I was able to exclusively breastfeed him for a year. And that was my goal. So at least with that, even though I did have a baby under phototherapy, I did have a baby with severe jaundice, but I still was able to breastfeed with effectively latching and pumping and supplementing with that. But if you guys have any other questions, you can let me know. So exclusively breastfeeding, perfect. And then we'll go over the benefits and just like some keys and tips for each one too. So number 1 was engorgement can cause fever, dehydration can cause fever. A lot of people breastfeeding and pumping, which is great. I'm the queen of pumping actually. Number 2 is if you pass large golf ball sized clots or fill an entire sanitary pad in an hour, that's all heavy bleeding. If your incision starts to have a foul drainage or smell, those are all signs of infection. And then pain on urination, foul smelling urine, those are all signs of UTIs. You also can have yeast infections, chest pain, vomiting, difficulty breathing. Those are signs of blood clots, which we did mention a few times since then. And then experience of harming yourself or others. Those are all postpartum depression. So those are all different reasons why to call the doctor. Now, I know we have a pretty much, at least from the ones that did answer, we have at least 4 people that are breastfeeding. We have a few people also that want to want to pump. So at least we'll talk a little bit about all of those. By the way, for the end of the class, for the ones that just came in, everybody that is attending this class is eligible for my giveaway, but you have to stay until the end of the class. And that's for the 26-day childbirth masterclass online. It has information about pregnancy, childbirth, breastfeeding, a whole bunch of great stuff. So to have that giveaway entry, all you have to do is stay until the end of the class. And I do have consultations, by the way. Just for today, anybody who signs up for a consultation will actually also get my childbirth masterclass for free. My consultations are $25 for 30 minutes or $50 for 1 hour. So it's not even that expensive or anything like that. But everybody who signs up for a consultation will actually get the full childbirth masterclass for free. And that's a one-on-one just between the two of us. It also comes with a digital copy of the session. It comes with ebooks. It comes with this PowerPoint too, and then the free access to the class, which is great because as much as I would love to just take everything that I know and like stuff it in all of your brains, of course, it might take some time. So at least this is a great way that you can ask me directly all of your questions, especially being that I'm a nurse as well as a lactation counselor, kind of give a different perspective, help you to know, what to do. And then to schedule your visit, there's on the description, there's actually, when you see the description, it'll say, if you're interested in a prenatal, newborn, or lactation consultation, contact me here and we can set up a package that fits your needs. On the description of this video, you'll see it. Or you can also email me at mommydidyouknow@gmail.com. That's mommydidyouknow@gmail.com. And then we can, set up whatever fits your needs. We can set up a time and all of that great stuff. And then that's just for today. If you sign up for that, you'll be able to get the childbirth masterclass for free. So newborn care, how to take care of your baby. Number one is skin to skin. So when your baby's born, so this is one of my favorite sections to talk about is baby care. So number one is skin to skin. That's one of the best things you can do is to help your baby transition to life outside of the womb. And you want to give your baby the best chance possible, of course. So at least with skin to skin, try to do it in the first hour of life to at least start it. And then once you're in the hospital, I know a lot of people I'll come in, I'm like, oh, have you done skin to skin? They're like, oh yeah, we did it once the baby was born. You can do skin to skin as much as you want for as long as you want. Honestly, even sometimes I'll do home consultations with a baby that's, a week old, 2 weeks old, 3 weeks old, even longer. And I'll still put the baby skin to skin as we're going to breastfeed, just because babies love that maternal contact. They love that skin to skin. So for all of my mommies who are planning on breastfeeding, skin to skin is one of the best things that you can do to help get you and your baby off to the right foot. So number one, a benefit of skin to skin breastfeeding is easier. Baby is closer to mom. She can see those feeding cues. Baby starts rooting, boom, 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 boom. Baby just, can latch onto mommy's breast. And then if we have a private consultation, I can also, if you are in the hospital or you're after you get home and you want to just make sure the baby's latched on appropriately, I can also help you with that. And my visits also come with a digital copy of the session as well. So you can kind of see what we talked about. You can keep it in your files, whatever you want to do. So number one, breastfeeding is easier. Baby's close to mommy. She can see the feeding cues, all that great stuff. Number two is it helps the letdown for breastfeeding. So for those of you who like anatomy, so I like anatomy, there's two hormones that really play a great role in breastfeeding. One is called prolactin, which is the milk producing hormone. So you think like P for prolactin is milk producing hormone. That is released when your breast is empty. So the more the baby empties the breast, the more prolactin is released and the more milk production you have. The other one is called oxytocin. I know that you probably heard of oxytocin with your uterine contractions, but oxytocin is also the let down hormone for breastfeeding. Now, oxytocin is released really a few ways, but there's a few that are big. Number one is that skin to skin breast compression that baby has when they are latched on and breastfeeding. So for example, let's say you have your baby that's on you and their hands are surrounding your breast and they're going like that and that's also why I say don't wear mittens while you're breastfeeding also, because when your body feels the baby's skin against the breast, they actually will start to release that oxytocin, that milk letdown hormone. So it helps your letdown to happen just by having the baby's hands around the breast. And as the baby is compressing with that skin to skin, your body senses baby and then starts that oxytocin production and starts that whole letdown process. So it's actually an amazing, amazing process of how that happens. So that's a great benefit of skin to skin. Number 3 is less crying and strong maternal infant bonding, which makes sense. You know, if the baby's skin to skin with you, they're going to be crying less. They're not going to be so overstimulated. So for those of you who don't know, babies also go through different behavioral changes. The first stage is about 1 to 4 hours of the active phase. So once baby's first born, they're going to be looking around. They're like, what's going on? They start freaking out. That's when the best time to breastfeed is also the first hour to, you definitely want to breastfeed within that first golden hour. But during that first 1 to 4 hours, babies are usually very alert. And then that's when they're going to be feeding very well. They're usually going to be sucking very well. You're going to have that great kind of reflexes going on. Then after that, you're going to have about 12 to 24 hours of a hibernation phase, where all of a sudden the baby doesn't really have as much energy as they had before. And they're just kind of like, boom, poop out. And that's when you hear, oh, you have to wake up the baby to feed and all of that. And you want to try to wake the baby up every 2 to 3 hours. This is a great time also to catch up on your sleep, just because that 12 to 24 hours of hibernation time where the baby might be sleeping in between feeding, so you can catch up on your sleep. Because after that, that's when the fiesta times, that's when the party time comes, and the baby's going to wake up. And then as the baby wakes up, it's like they'll want to cluster feed. So if you ever heard that term, cluster feeding, that's when the baby is going to be feed. They might have a little pause. Then they'll feed. And that's when you'll hear, man, the baby just won't stop eating. What is going on? And now it can be an ineffective latch. Sometimes it can be that. That's why it's really good if your baby is cluster feeding. You can call your nurse in, see if they have lactation support. You can also contact me, mommydidyouknow@gmail.com. We can schedule your visit. You can also click on the link below, and at least you'll have all those resources for you. But sometimes the baby wakes up and they start cluster feeding. What happens is the central nervous system that the baby has goes into overdrive, and they're taking in all of this extra stimulation. So if you ever heard of the central nervous system, that is what happens is it's taking in all of this information and it's going into overdrive and starting to overstimulate the baby. So that's why the second and third days, especially, babies start to be crying more often. They want to be nursed. As soon as you put them down, they start to cry. People are like, what am I doing wrong? Do I not have enough milk? What is going on with my baby? Usually it is just an overactive central nervous system. The baby is just taking in a lot of stimulation at once, and then doesn't know what to do with that sensory input. So skin to skin helps with that second to third day kind of second night syndrome where the baby's just up overstimulated. So that skin to skin helps to calm the baby down. It also helps to maintain blood sugar and also helps to maintain the temperature. So if you think about it, you've never seen a baby shiver when they're cold, right? Babies don't shiver when they're cold. When babies are cold, they actually break down sugar, their glucose, to maintain their temperature and keep themselves warm. So as the baby is on mommy, of course, the mom is going to be much warmer than a blanket in the crib. So as baby's on mommy and warm, taking mommy's temperature, baby does not necessarily need to break down as much glucose and as much sugar to keep warm, because mommy is controlling baby's temperature for him or her. So that's actually a really, really cool kind of bit about skin to skin is that skin to skin maintains the temperature. And as the temperature is maintained by mommy, baby can focus the blood sugar on other processes in the body and not necessarily for temperature. So that's why if you, let's say you have gestational diabetes or you have some problems with the blood sugar, baby's small, baby's premature, that is where the skin to skin comes in handy, because the skin to skin helps to maintain the temperature and helps to maintain the blood sugar. So that's perfect. Number 5 that I have here is also breathing regulation for baby. If you think about it, if baby's on mommy, baby is calming down, baby's on mommy, it helps with the baby's breathing. It helps to keep that respiratory distress. If you have a baby in respiratory distress, at least it kind of helps to calm that baby down and regulate the baby's breathing through mommy. Also, number 6, when I was reading this study, I actually was amazed because it makes sense. I just never thought of this as an actual treatment. But number 6 is actually lowers mother's blood pressure. So if you have gestational hypertension, you have PIH, you have pregnancy-induced hypertension, you have high blood pressure after you delivered and you don't know why, studies show that actually skin to skin lowers mother's blood pressure. I guess it kind of calms moms down and it helps to regulate their vital signs. So I thought that was actually really interesting. And as a nurse, I would love to see how I can put that into practice. I know for babies, I do skin to skin a lot for treatments, such as if a baby's cold, for example, sometimes I will I'll put the baby skin to skin with mom. Sometimes I'll even put a warmer over both mom and baby. And I noticed that that helps to control the temperature. I've actually had babies that had low blood sugars, and I put the baby on mommy and then the sugars went up. But I actually would love to introduce this into practice for moms that have high blood pressure, that I put skin to skin. How does that help blood pressure? So I'm really excited to see how that kind of goes in with my practice. Number 7, which makes sense as well, is it decreases risk of postpartum depression. So if postpartum depression rates are increasing right now, the more that you have your baby skin to skin with you, the more satisfied you are, you feel connected. Keep in mind too, I know that we have a lot of breastfeeding moms here, and if breastfeeding is your choice and that's what you want to do, that's your goal, that is fantastic. However, I also want to let you know that your success or ability to breastfeed does not correlate to your ability as a parent. I know that a lot of people, they kind of correlate this. If I'm able to breastfeed, that makes me a good mom. Now, breast milk is great for babies. There's so many benefits. You have so many great immunities that's transferred through breast milk. But if you are not able to breastfeed for whatever reason, a maternal reason, baby reason, it is your preference, that does not make you any less of a mother than a mother who is breastfeeding, okay? And that includes even combination feedings. Now, I'm pro mom, more than anything. I'm pro mom, I'm pro baby. I know that there's some people that are like, I'm pro breast milk, pro formula. I am not any of those. I am pro mom, I'm pro baby. In the end, I'm on your guys' side. You are the mom, you are the one that makes the decisions. Me as a nurse, as a lactation counselor, my job is to help you guys to achieve your goals by preparing you to the best of my ability and the knowledge that I have. So in the end, whatever your decisions are whatever, that is the path that you guys take. And then in the end, more than anything, we want a healthy baby. So I mentioned this a few times also, but I have yet to see a baby that follows the manual exactly how it is written. There is no baby manual that will exactly match your baby. Every baby is different, and that's okay. That is what makes us special. That's what makes us beautiful. So as you're going through all of this, please just keep that in mind, that in the end, what is most important more than anything is that you have a happy, healthy baby, and that you as a mom are doing the best in your ability and with your choices. So that was my little tidbit for right now. So for diaper changes, I know that Sometimes the first diaper is the scariest. And I know we have a few first moms in here. You know, first moms, you guys can wave hi. I know that we have a few, but first time moms, I know the first time that you're changing a diaper, the first time that you're doing the bath is always the kind of the scariest, but it doesn't have to be that way. Number one trick that I have is I put the new diaper underneath the old one. It kind of just helps to, yeah, so we already have a few people saying hi, first time moms. But first, put the new diaper underneath the old one. What that does is it helps to make that diaper change quicker so that you can, you know, finish up quickly. And if there's more poop happening as you're changing that diaper, that at least it catches everything. Remember, the flaps go on the back. So if you have a diaper, you'll have the flaps, they go on the back and then they attach on the front. It is actually harder to do it the other way, but surprisingly, people still do it the other way. I know my mom still did it. I'm like, you had me, you had my brother, now I'm on my second kid, and my kid's getting off of diapers now, but every now and then she'll still put on a diaper on him and she'll put it on backwards. I'm like, it is harder to do it that way, but somehow that happens. But the flap always goes from the back and then it attaches to the front. Use the old diaper to wipe a little bit off first. Use a clean wipe, obviously. You don't have to change the wipe every time, but what you can do is fold it and use it, fold it and use it. And then for girls, always front to back, because you don't want to have any of, you know, any fecal matter coming into the vaginal area. You might see some whites on baby girls. It's just normal vaginal flora that you'll see that babies have. It just kind of keeps stuff out that doesn't need to be there. So if you see any white vaginal flora there, that does not necessarily mean the baby has a yeast infection. You can keep it there unless there's like poop. If there's poop there, please do clean it off. You don't want to leave poop in your baby. But if it's just there, it also can be vernix, which is one reason why some people also choose to delay their bath, because the vernix is like a natural insulator for the baby. So sometimes you might see that as the baby's born, across their pelvic area and in their private area as well. So if you have vernix there, you don't want to wipe it all off, because that is great, kind of keeping everything nice, toasty and warm. Baby boys, always remember to clean under the testicles. Keep in mind too that it might be a little engorged, it might be a little swollen in the beginning. You know, don't be discouraged. You don't have to do anything for that. It's just all of that extra fluid that babies have to get rid of. And then also don't be discouraged if they pee or poop as you're changing, you know, that's normal. Make sure all of your diaper changer supplies are next to you. So what I do is if I'm changing a diaper, I'll have my diaper, I'll have the wipes right there. If we want to have a change of clothes, you know, if it's like a crazy poop disaster, you can have a change of clothes next to you. I try also, if you have a circumcision, have some gauze and Vaseline on the side as well, just to kind of treat that circumcision, which if you are having a circumcision, it's about 7 to 10 days, you would want to treat it with gauze and Vaseline. And then feeding your baby. Now, of course, there's so many different methods to feeding, and there's 5 million different ways that you might choose to feed your baby or that your baby has to be fed. But number one, of course, you have exclusively breastfeeding. So you have a few people that's on here today that want to exclusively breastfeed. The tips with that is number one, try to feed as quick as possible. You know, if your baby is within the first hour of life, try to feed early and frequently and efficiently. So make sure that your baby has a nice wide open latch. It's baby's breastfeeding, not nipple feeding. So if your baby, like let's say, and this goes for the people that are some breast milk, some formula exclusive, and some pumped, whatever it is. So let's say this is the breast, and you have your nipple here, right? You want to make sure that the baby is over not just the nipple. The baby's not nipple feeding. You want to make sure the baby's on the breast as well. Then as the baby's on the breast and contracting like this and compressing, that's how the milk is going to come out. As you can see, I'm not on the nipple at all. So if the baby's on the nipple just like this and very shallow, one, you're not going to be transferring milk. Two, it's going to hurt a lot because obviously your nipple is going to get very blistered and cracked. You might feel tugging, but you should not feel pinching, and breastfeeding should not hurt. If it hurts, it feels pinching, you're getting cracks and blistered and bleeding, that can be a sign that your latch is a little off, in which case you would definitely want to schedule a consultation. You would definitely want to look into it. If you are in the Palm Beach area, I do have consultations for Palm Beach and Broward as well, in, if you're around Florida. Number 2 also is if you're exclusive breastfeeding with some direct breastfeed and some pumped. Anytime you're supplementing, whether it be breast and formula or breast and express breast milk, or whatever have you, always breastfeed first. So always put the baby to the breast first, just because babies will always work a little harder in the beginning of the feeding rather than the end of the feeding. So if you start off with the bottle, they're going to use all of their energy on the bottle. Then when it's time to breastfeed, they're not going to have the energy that they need. They're kind of like a reservoir of energy. And then once that energy runs out, boom, that's it. So at least if you are doing your breast first, that's when they're going to start off on the right foot. And then some breast milk and some formula. You can have even, some people do all 3. Some people are doing direct breast milk, then they're pumping, giving that, and then still giving the formula after. If you do that, what I would do is do the direct breastfeeding first. Then I know some people mix the breast milk and the formula, which technically health-wise, there's really not a big issue with that as long as you're feeding it directly. But what I noticed is you might be losing breast milk, because let's say what I prefer honestly is put the direct breast milk, then whatever express breast milk you have, give that, and then give the formula. Because let's say the baby does not complete the whole bottle, what ends up happening is you're losing breast milk, which of course is precious. So what you can do is direct breastfeed first, then you can pump whatever you do get on the pump, you can give that feeding, and then whatever left over, if you wanted to do the formula after, you can do that as well. But those will be kind of the hierarchy of what you want to give and when you will give it, which is important too. Everybody has different methods of what they want to do. So on the PowerPoint, I do have a little video here, and on my YouTube channel is awesome, by the way. If you have not subscribed to it, you definitely should subscribe. I have breastfeeding tips, I have baby care tips, I have pregnancy, childbirth videos, and I am a medical professional, so it's great. That's actually the one reason I got into this, was because I was looking at resources that people were using to, educate themselves and prepare themselves for childbirth. And honestly, it kind of gave me the heebie-jeebies a little bit of what they were saying, because they were not really rooted in evidence. So make sure if you are preparing yourself from childbirth that you know the source of the information. Make sure that they are a medical professional. So I am a licensed professional. So this is a great channel that you'll be able to get some really great information off of. So make sure you can always like it, you subscribe it, and I have so many videos. And like I mentioned before, if I have exclusive benefits that are only available for people that sign up for consultation. So if you want to, you can click on the link on the description as well. Like I said, my packages start at $25. And just for today, you'll also get exclusive access to the Childbirth Masterclass. If you sign up today, you can even just send me an email. You don't necessarily need to sign up for the video, for the consultation yet, but at least you can send me the email to save when you want to schedule it for, and at least we can get you started on that. You can even do your childbirth class before you have your consultation if you wanted, but it's a great package because at least it's all together to help you prepare, especially for those that are in the beginning of your pregnancy, because at least you can talk to someone during your pregnancy. And as things change and things progress, at least you'll have someone to talk to that actually knows what's going on. So we have a few benefits of breastfeeding. It's free, reduces risk of SIDS, less chance of ear infections, less colic and gas, better microflora in the stomach. Your stomach, your gut, and your brain talk a lot. So it's a really great thing to have good gut microflora, gut microbiome. It also helps with immunity. So great stuff. Now, when you're latching, by the way, you want to make sure that you follow these 3 steps. Number one is that you are tummy to tummy. This is Violet, by the way. This is my kid's little doll, but tummy to tummy is number one. Okay, you would want to have nose to nipple. So this is a cross cradle position, which I do have in my class as well. So as you can see, I have the baby well supported with my arms. Feet, babies hate to have their feet dangling. So I'm supporting their foot with my arm. And then I'm supporting the head and the neck here with my hand. Then what I'm doing on this side is I'm making a C position, but I actually have a special technique. It's called Rachel technique. So what you do is if this is your nipple, you're taking your hands here, you're taking one finger, putting it right underneath the nipple there, and that helps to get that nipple out a little bit. And actually, if you try it right now, you'll see what I mean, that it actually helps to get the nipple out. Then when you put the baby on, you express a little bit of that colostrum, not in the nipple, but actually in the areola. So what you're doing is you're just compressing like this, and then the milk will come out. You can put the baby on. So first you get tummy to tummy, nose to nipple. And then when you put the baby on, you're bringing the baby to the breast. You're not going like this, bringing the breast to the baby. You are bringing the baby to the breast. So as you have your tummy to tummy, nose to nipple, because what happens is as the baby smells the breast milk, they go, ah, and they open nice and wide and latch on for you. So that's how you're going to be able to breastfeed with a nice wide open latch, which is really the key of breastfeeding. And I have so many other tips for you as well. So if you sign up for the classes, you'll see on the description as well, the link that says sign up for classes and consultations and stuff. It has all the different resources that I have, and you can also sign up for consultations. So we have, this is our post test. So I know that we've talked about a lot of stuff today. So whoever is active in this test will be eligible for the giveaway. And then I will be announcing the giveaway winner. And the giveaway will be for the Childbirth Masterclass for free with no strings attached. Number one is, let's see, what are some normal things to expect after childbirth? So anybody who is watching this right now, you guys can answer this question. What are some normal things to expect after childbirth? Now, the people that are active and answering these questions are the ones that will be eligible for the giveaway. So at least it is one way to test your knowledge, and at the same time, we can reward those who have been paying attention and hopefully get somebody a free class. So we talked about some normal things to expect after childbirth. We talked about some things that were to be expected after fluid imbalances. We talked about shivering. We talked about bleeding. Exactly. Very good. Thank you. Bleeding is normal after delivery. If you're saturating a pad in, under an hour, if you have big blood clots coming out, those are definitely signs to call the doctor, but that is normal to have some light bleeding. You also might have mood swings, but if it starts to tend towards postpartum depression, you want to call your doctor, and you might even have some shaking, which happens because of the fluid imbalances. Now, what are some keys to recovery? So this probably also, I know some of you guys were not there for the first part of the class, so that's probably why you don't remember what the things to expect after childbirth. But what are some keys to recovery? So these were different things that you can do to feel better after you have your baby. So these are different things that you can do to recover quicker after delivery, whether it be vaginal delivery, C-section. I did mention a few things that you can that you can tell your doctor about. Now, what I usually recommend too is have a consultation during your pregnancy, also to kind of know what to expect. And then I also do consultations if you're in the hospital and you have questions. You can always talk to me about that. And then I do another one, transition to home consultation, where you can kind of make sure that everything is set for you and the baby. So walking, changing clothes as early as possible, showering, getting rid of lines, IVs, exactly, walking, urinating frequently. You guys have been paying attention. I'm so excited, yay. Now let's do one more question, okay? What are some benefits of skin to skin? That is my last question. What are some benefits of skin to skin? Now, the people that answer these questions, they are the ones that will be eligible for the giveaway. And all of you guys were correct. So urinating, walking, showering, and then that's good. It's funny how many people I have to actually remind them to shower, but yeah, it's very, very true. So at least we talked about some benefits of skin to skin. Now, for those of you who have been active in this quiz, you guys are eligible for the giveaway, which will be for the full Childbirth Masterclass for free. That's a $50 value with no strings attached at all. So all you have to do is say between 1 through 10, a number between 1 through 10. And then if whoever guesses my number will be the one that wins. So you guys can say a number between 1 through 10. And then I will let you know who wins. And then I see some benefits of skin to skin, improved glucose control, decreased BP per mom, better bonding, decreased postpartum depression. All those are great. Helps milk let down, less baby crying, breastfeeding is easier. Wow, there's so many benefits of skin to skin. Lower chance of postpartum depression, regulates baby's blood sugar. Yeah, so it really is great. So we have a few people that entered already. I'll give you guys another second to think of a number. I know that's the hardest question that we've had so far. And I hope that you guys enjoyed this class. So what was everyone's favorite part of the class? What was your favorite thing that you learned? I mean, we learned some great stuff today. So hopefully there was something that you're like, wow, that really blew my mind. And then you can always share these resources with any friends or family that you have. I would be more than happy to support you guys, support any friends or family that you have. So the winner is Kimberly. My lucky number was 7. Yay! So what you can do is actually send me an email. Let me write it over here, just because I don't want to say any private information in front of everybody, So mommy, did you know @gmail.com. So that's mommydidyouknow@gmail.com. So Kimberly is the winner. Congratulations. So you won my full Childbirth Masterclass 26-day class of $50 value, absolutely free. You can give yourself a pat on the back. All you have to do is send an email to my email address. I will send you the link and go through the instructions so that you can claim it. So it's absolutely fantastic. Everybody else, you can also, that email address that I sent you. So like I said, for today, anybody who asked me about a consultation, not only will have the consultation scheduled, but they will also get access to the Childbirth Masterclass for free. The same one that Kimberly's getting, you will be able to get as well, a 26-day full class if you email me, and we can start, getting you situated. And then I love how she said my favorite part was the whole class. It was very informative. So I'm glad that that you guys really loved it. I can see that. So thank you all for watching. Thank you all for joining me today. And remember, you can still subscribe. You can like the video. You can share it. I'm so happy that I got to meet all you guys. I hope that we can stay connected. It really is great to be able to be prepared. Especially things are always changing in the hospital. There's so much information to know. And it was so nice to meet everybody. So I hope you all have a wonderful rest of the day. And you can always let me know if anything. And yes, of course, reducing postpartum stress is so important. So I'm a very kind of outgoing, peaceful person. So anything that kind of reduces stress is always a good thing, releases complications. But I hope you guys have a good rest of the day. Remember, you can always email me to set up consultations, to also Kimberly can email me to redeem your course. So it is absolutely fantastic. Okay. So I hope you guys have a wonderful rest of the day, and just let me know if you guys need anything else at all.